Welcome to this very special edition of the KAJ Masterclass Live, the show which ensures that you profit from your time spent here with experts, either through their industry insights, information, or simply learning from them. And today we have with us Dr. Troy Rohn. He has over 2 decades of experience in neuroscience research and teaching. He's a neuroscientist and co-founder of biotech company Khudania, and he's also an author. So we'll learn from him why haven't we meaningfully improved anxiety treatments in decades, and what if the next breakthrough comes from gene therapy. So we'll learn about that, his personal experience with anxiety, and also what the future of mental health treatment could look like. Welcome to the show, Dr. Troy.
Thank you. Thank you very much, AJ. It's great to be here to talk to you
You are wel-
about an important topic, obviously.
You're welcome. Welcome to the show, Dr. Troy. Welcome to India in this online form. And I'm sure not just in India, but a lot of people across the globe will benefit from what we are going to talk right now. We'll discuss with you, learn from you about gene therapy for anxiety, for which you are doing research and much more. So we'll talk about all this. But before that, let's talk a bit about your journey, your background, your story, so that the audience knows who they are listening to.
Yeah. So I am a neuroscientist. I'm a professor here in Idaho at a university, and I've done basic research in Alzheimer's disease. Actually, is my forte, but I have lived with anxiety for all my life, and um, I, I kind of became frustrated with the current treatments that are available to myself, in that, you know, they don't really work well, especially for me, like when anxiety really comes on hard and fast. And so that kind of got me to think more as kind of a scientist, with my background in neuroscience and pharmacology. I'm like, is there a better way? Is this the best that we can do? And so that's where I kind of teamed up with some colleagues to co-found this company called Cognigenics. And, we're really looking to treat anxiety and other neuropsychiatric disorders in a totally new way. And that's using gene therapy, which is, really on the cusp of exploding right now. And the basic idea is with gene therapy, you get precision. Okay. The, um, the analogy I like to use is that, if you're thinking about rewiring your entire house, which is what the current medications kind of do, is they kind of boost a chemical called serotonin throughout your brain. Gene therapy is like rewiring a single circuit. And so you get much better precision, you get fewer side effects. And one of the other advantages is that you don't have to take pills every day. So that's kind of the guiding principles of gene therapy. And so we're still in the preclinical stage, but we're getting closer and closer to clinical trials.
Absolutely, absolutely, Dr. Troy. So, how should we understand anxiety? Isn't it something part of us being human? Some may
It's
have less, some may have more. Why?
I mean,
And for, okay, carry on.
no, I mean it's a great question. I love this question because anxiety is actually normal. It's a way that we adapt to a fearful situation. So you never would want to completely take away anxiety from somebody because it's a warning system. It's like a smoke detector. But when it becomes maladaptive and chronic, then it begins to interfere with your personal relationships or professional relationships. And basically chronic anxiety, it's like that smoke detector that keeps beeping even when the fire's gone. And you know how annoying that is. And so it really is just a system that becomes overreactive, over poorly regulated. And it really has to do with circuits, and that's really been The problem is that anxiety is really rooted in our brain circuits, our genes, the proteins that work at the molecular level. And so again, that's the value of gene therapy, is that, we can have precision biology, not just medications that are, kind of a sledgehammer, if you will.
Absolutely, absolutely, Dr. Troy. I get your point. If I'm looking at purely from the audience side. I'm not an expert. I don't know much about it except that during before every show, I just I'm a bit more alert, anxious. I don't know whether or not, but it keeps me alert towards being in show whatever number of shows I have already done. But that helps me to be awake, to be very much awake to my guests. So that is one thing. But from a human perspective, have we, on medical perspective, have we lost all hope that medical science will be able to bring about changes or impact with the present level of medication? And then we are or is it like, because it looks like this whole field is opening up. People talk about, and correct me if I'm incorrect in any place, people talk about psychedelics, people talk about plant medicine. A lot of people nowadays say, meditation is helping, yoga is helping, those ancient ways of calming yourself in situations when anxiety is not normal anymore. Then are we rushing a bit more faster towards something which can still wait and only if needed? How should we look at it from a common person's perspective, in terms of, yeah, that there are a lot of options available, but we are looking at it from a gene therapy perspective?
Well, when we talk about anxiety, there are these connections in these circuits in the brain that are overexcited, and you can actually measure this. There's tools that measure this brain activity, and one of the things that these alternative therapies that you just discussed, like psychedelics and meditation, really what they're trying to do is to put the brain into a brain activity level we call that's represented by what we call theta waves. So like currently me and you right now, we're probably like really in alpha and beta. And that's generally like full arousal, a little bit of anxious, like you said, whenever even you're a pro at this, but you still get that kind of nervous energy. But what theta is, it's kind of slowing down the brain. And we know that when you're in that stage, for example, that's what people do when they meditate, it really improves mental clarity. It can decrease our anxiety. It can improve our memory. And so the basis of this is there's one receptor. So what a receptor is, it's a protein that interacts with a neurotransmitter chemical. So for serotonin, serotonin is a neurotransmitter chemical that's very important for mood. But you have 15 different receptors for serotonin in your brain. But what we know is it's one of these receptors, the 5-HT2A receptor, that's really linked to anxiety. Okay. So what we propose is, let's tune down that receptor with precision, right? And get into that mindset, that theta wave mindset, where we now have improved mental clarity and lowered anxiety. So again, that's really the benefit of any kind of gene therapy, is instead of trying to, increase serotonin, acting at all the receptors of serotonin in the brain, what if we could just modulate one of those receptors? Okay. And that's kind of the principle for any, you think about just last week, there was this major, the FDA in the United States just approved gene therapy for children that are born deaf. And what the gene therapy does is it delivers a missing gene that then provides the missing protein that allows these children to hear again. And that's just it's being very precise but it's selectively treating the problem. And that's what we're trying to do with gene therapy. And the problem, AJ, is that it's very complicated science when you're talking about things like CRISPR and RNA interference. That's one of the reasons why I wrote this book, was not only to kind of talk about my own kind of personal journey with anxiety, but to really demystify what gene therapy is, and to really explain it to people that don't have a science background, because I really see this as revolutionizing, changing medicine. It already is, but like you said, it's exploding right now.
Absolutely. So, what is gene therapy? I also don't know. Means I've heard the word, I can assume I know enough to at least ask you. But beyond that, I don't know. A lot of people do not know. Many will assume it's playing God. Will it be like that? You talked about receptors. Now, you think that as of today, you know about the anxiety receptor. You put it off. But how do we know that it is also there for hundreds of other things that we do not know about? Help us understand the impact of gene therapy for this particular thing called anxiety. From that point of view, for a common person, a lot of people might find it hopeful, helpful, but I want to also understand, is our knowledge enough? Can we be assured of putting something, off? Can it be put on if needed at a later stage?
Yeah, I mean, you never know for sure until you run the clinical trials and test the drug. But, like our company, we've been doing preclinical research for 7 years now in using animal models like rodents. And what we found is that when we alter what we call the expression of this receptor, the 2A. So what happens, as I talk about in one of the chapters of my book, the ABCs of gene therapy, is that everything begins with us at the cell level with our DNA. And then the DNA is like a blueprint that provides instructions that are dispatched in the form of a middle manager that we call RNA. And then RNA is used to, those instructions are used to build a protein. And it's the proteins in our cells, the 100,000 different proteins that we have in our cells, that are giving us all these unique behaviors. Okay. So what gene therapy is doing is it's targeting either a faulty gene, it's targeting, in our case, a gene that's a protein that may be overactive. So, you're turning down the number of these receptor proteins. You could be replacing a missing gene. It's very versatile, but as you say, with it comes, ethical considerations, because if you're talking about the CRISPR, which is just this powerful technique, that's actually changing the DNA itself. And, people get very nervous about that, which they should. But there's a whole other level of gene therapy that targets the RNA. So that's one level down. And the RNA in our cells is it's basically like Snapchat. It's a message that builds a protein and then is quickly degraded. So it's not a permanent change. When you try to target the RNA level, you're not changing the DNA of a person. But the flip side of that is that it's not a one-time cure like CRISPR. And when you change the DNA, it's fixed. That's it. No more treatment. You're done. When you're dealing with RNA therapies, you have to keep providing the treatment, because you haven't fixed the faulty gene in the first place, if that makes sense. So, our company right now, we're really looking at an RNA therapy because, we're talking about anxiety. It's not a life-threatening disorder for the most part. It's not fatal. And so, people are much more comfortable with something like an RNA therapy that's not going to be irreversible if it does produce something that we don't want to, unlike CRISPR, which, that, you can't take that back, basically. So again, the science is very complicated. AJ, and that's why we had such our company had so much trouble in the beginning because we just couldn't get people to investors to understand what the heck we were doing. And again, that's one of the reasons why I wrote the book, was to try to like break this down. Like, here, Mr. Investor, here's my book. Read this book. You'll understand what gene therapy is all about, because it's hard to explain it in like 2-minute sound bites, to be honest with you.
Why this difficulty? Gene therapy people know, as you said, recently US FDA cleared the use of for in terms of deaf and all those problems. So people understand it. It is only in certain areas that people want to understand things better. And when you talk about gene therapy, people think it's a cure, and if it's a cure, then people will. But in your case, if I've understood, it is not a permanent thing. It will need to be continuously, taken. I don't know what's the delivery mechanism here, drug delivery, injectables, or whatever it is. And people will see it's another kind of big business by the medical industrial complex.
Exactly.
I have to understand it for the common person. Everyone has the right to understand.
Yeah.
I cannot agree on their behalf. My question is, on their behalf, how should people understand? You want people to understand this.
Yeah.
Your book might be for investors, but is it also for the answers for the common person?
Absolutely. So the simplest way I can tell you is, if you're interested in gene therapy, the question I would ask is, well, is this going to change the DNA or is this going to change the RNA? And there's your answer, because we have, for example, there's a therapeutic, FDA approved therapeutic for sickle cell anemia. That is a CRISPR DNA approach. That's a one-time treatment, and they are cured. Okay. But when you go back to RNA therapy, there are ways to design the RNA therapy so it's much longer term. And the delivery mechanism, which I think is important because it's not easy to get anything in the brain, we're actually using an intranasal delivery system. And so there's no shots or anything like that. It's basically like, and you sniff something. So that too is pretty novel. But it really gets down to, for people to understand, you have to have some basic understanding of what a gene is, what RNA is, and what a protein is, because that's really what we're talking about here. The ABCs of how our cells work. And if you don't have that background, it's difficult to understand, right? Because it's really it's science, right? I tell my students, it's not rocket science, it's neuroscience. It's hard.
Right. In your case, how did you get, help for your anxiety? To me, you are like, you are much more better controlled. I am excited about the show. You are much more controlled in spite of my probing questions, difficult questions, Dr. Troy. So, from the point of view of anxiety, uh, is it taken care of? If yes, to what degree? If not, then I don't know about it. I want to understand that, have the present level medications helped you to what level that you are talking about the gene therapy?
Yeah, great question. So, from my own personal, experience with anxiety, um, it's not just about medications. Therapy is really important, and I talk about that in my book. That you know, understanding the root of our anxiety really helps understand why you're feeling the way you are in certain situations. And most people are surprised to know that one of the biggest risk factors for any kind of anxiety disorder is childhood trauma or neglect. So these things are happening very early in life. And for me personally, when I think about counseling as a holistic approach, because it also helps provide you with tools when you are facing a situation that may be very anxious. For example, if I'm coming on your show, I want to be prepared. I want to, okay, what kind of questions is AJ going to ask me? And how am I going, just thinking through the process. If I'm going to a music concert, my anxiety is very situational. And so when I'm around a lot of people and crowds, it really makes me nervous. So just visualizing that process, how am I going to get to the concert? Where am I going to sit? You know, how am I going to, interact with people around me? And these seem like kind of like dumb things, but for people that have anxiety, that visualization process can really help reduce your anxiety once you're actually in the midst of the situation. So I think to get to your question, medications are only part of the answer. And for a true holistic approach, we always want to incorporate some kind of counseling with your healthcare provider, some kind of support. I actually have a service dog, and she goes with me everywhere. And she's wonderful. Dogs, for example, are great for they. There's lots of literature to support that they can reduce our anxiety. So again, it's not just the medications. I think that's important to note.
Absolutely. How do you see this whole path towards gene therapy opening up, or do you see it not opening up? When do you see something of a reality in the coming days? 1 year, 2 years, 7 years? How many years?
Well, like I said, I think it's already upon us. We look at other cancer and other fatal disorders, very difficult diseases. For neuropsychiatric disorders, I see it coming soon. Our own company, we're about ready to do a major study this month. And I would say, based on the data of that study, we could be easily a 1 or 2 years from clinical trials. So 2 years at the most, a year at the soonest. And it's a long road. There are always lots of hurdles when you're talking about gene therapy and the ethical issues and the getting past the FDA and all that. But I truly believe it's coming, and I would say within the next 5 to 10 years, there will be gene therapies available for people that have neuropsychiatric disorders like anxiety.
What is the percentage of people, does your research say, may benefit from this particular, you know, uh, futuristic gene therapy that you are talking about?
Well, if we're talking about anxiety specifically, we know that with the current medications, which are the SSRIs like Zoloft and Paxil and Prozac, those are the most commonly prescribed medications for anxiety disorders. About 30 to 40% of those individuals do not respond well. And so you're talking about a large segment of the population of those with anxiety that are not being sufficiently treated. Millions of people basically. And so there certainly is a lot of room for improvement. And, we need to change our mindset from using these, old purposed chemical drugs and again, really attacking the anxiety at the root level. And that's what gene therapy does.
Absolutely. What is the view of the medical fraternity on this particular issue?
I think that whenever we've talked to people, scientists, doctors, they are so excited about this area of science. I mean, I think the opportunities to help people cure diseases, I mean, it's just going to change medicine. I mean, there's just no other way of putting it. I think there's a reason why Dr. Dwadna, who discovered CRISPR in her I can't remember the French, the gal's name, but There's a reason why they won the Nobel Prize in 20, I think it was 2022, if I'm not mistaken, because we know that this is a game changer. Gene therapy is going to be it already is. It's already, I mean, there's already 15 to 20 just CRISPR DNA therapeutics, let alone all the RNA therapies that have already been approved. And, every day it seems like there's a new drug, a new therapy that's coming out that's gene therapy based. So that's really where medicine's going. It's going to become more personalized based on your own genetic makeup. And, it's just really a matter of not if, but when.
Absolutely. There's much to understand about all this from you, Dr. Troy, and I'm sure a lot of people would want to connect with you, learn more about this, and perhaps, also want to read learn from your book. What's the best way for them to do so?
Oh, geez. Yeah. I need to start, I don't do social media at all. I have an assistant that helps me with all that, but I really do need to learn some of my handles, I guess is what you call them. I don't know, but I think the best way, if you're interested, is you could just Google Troy Rohn and brain medicine, and I think it will pull up all important links to my book is available for pre-order on Amazon.com, Barnes and Noble, and through my publisher, Penguin Random House. So, yeah, I know I have an Instagram page. I know I have a Facebook page, but I could not tell you what those names are. I'm sorry. But I need to do that, right? You think a guy that's trying to market his book would know that, but I think that just gives you a little insight of my personality. That kind of stuff is just I'm not really hip on it, to be honest with you.
This is perfectly all right. Internet is the best social media. Individual platforms will keep on coming and going, and that you have done perfectly all right. With this, it's a wrap on this very special edition of the KAJ Masterclass Live. Thank you so much indeed for joining us.
Thank you.